Our current event news of the week. CDC is pulling back $11 billion in COVID funding sent to health departments across the U.S. The Centers for Disease Control and Prevention is taking back funds that were allocated in response to the pandemic to state and community health departments, non-government organizations, and international recipients. The Department of Health and Human Services, they confirmed this week. The COVID-19 pandemic is over, and HHS, Health and Human Services, no longer wastes billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago. And this was said by Andrew Nixon, Director of Communications. Notices have been going out on Monday, and awardees have 30 days to reconcile their expenditures. So they got to explain where the money's going, or they got to balance things out in the middle of tax season. Yikes. The funding slash comes on the heels of other cuts under new Health and Human Services Secretary Robert F. Kennedy Jr., including the canceling of hundreds of millions of dollars in grants for research into vaccine hesitancy. Is that hesitancy? LGBTQ populations and supporting HIV prevention. We don't talk much about HIV anymore. I remember when I was younger, it was like huge. It was like huge deal. Like there were specials, there was programs, there was movies, I think there was even shows. Like it was a big, huge thing. And it's not talked about as much. And I attribute some of that to the advances that they've made in the science field regarding it, where there's ways to live with it. There's medication. People aren't dying like they were. Like it was bad back in the day. It was really bad. But I don't know if taking funding away to support HIV prevention is the way to go. Why are we? Okay. All right. Now that the pandemic is over, the grants and cooperative agreements are no longer necessary as their limited purpose has run out. And that's what was read or sent to or shared with the NBC News. Okay. So the federal public health emergency ended May 11, 2023, but more than 1.2 million people in the United States have died from COVID. Infection has slowed and the disease has become milder. Hundreds of people still die every week from COVID, and long COVID symptoms continue to cause debilitating medical problems in some cases. We may not be in a pandemic like that, but I don't know if pulling all the funding from it is the way to go. I mean, the least you could have did was like cut it, maybe cut half the funding. Like you went full scorched earth, like removing all of it. It's I feel like this is over. What's the word? It's overdoing something. You went too far over. Like come meet back in the middle, right? So the clawback funds were largely being used for COVID testing, vaccination, community health workers, and initiatives to address COVID health disparities among high-risk and underserved populations, including racial and ethnic minority populations and rural communities, as well as global COVID projects, according to CDC leadership. All right, so again, if you want to kind of scale back funding, maybe make some cuts, okay, I wouldn't remove the whole thing, but also the cuts that you're making, where's that money now that you cut? Where is that being allocated to? Where's that going? Well, you're just cutting to save money, or are you cutting because you're going to use it for something else? Is there another? I mean, there's so much more that we could be doing with with health, and I don't know. So I feel like just cutting it without allocating it to another area that's much needed is okay. Interesting. So CDC reviewed a list of HSS provided COVID grants and cooperative agreements and identified the programs that were no longer needed. Okay. All right. So maybe some of these programs have run their course. Things aren't as dire. Okay. But where's the money going to go? Where are you putting it? Are you going to effectively put it into something beneficial for the citizens of the country that we're in? Hey guys, quick aside. If you like what you're seeing and you like what you're hearing, feel free to give the video a like, subscribe, and hit the notification bell so you can always be up to date on what's going on. And for those who don't know, I'm a writer, director, and producer with my own series, The Zombie Chronicles, which you can also check out on Amazon Prime or Tubi. And those looking for a way to help support further, you can check out my Patreon, NXG Global Productions, where I discuss more movie reviews, access to clips of my writers group recordings, first look at behind the scenes, shout outs on social media, posts, and more. I'm looking to grow the community and would love to have you be a part of it. Plug over. I'd like to think so, but you know. All right. Now, Kristen Iodice, a communications director for Colorado's Department of Public Health and Environment, she's got some concerns. She stated, "We are concerned that the sudden loss of federal funding threatens Colorado's ability to track COVID-19 trends and other emerging diseases, modernize disease data systems, respond to outbreaks, and provide critical immunization access, outreach, and education, leaving communities more vulnerable to future public health crises." Okay, so she makes it sound like they're cutting the CDC. The cutting isn't just like COVID related. It affects other diseases or preventions that we want to look out for. And prevention, what does prevention look like? What does it look like? Because that's again, like it, where we're at with COVID now isn't where we were at in 2020. I agree with you. But is it best to kind of, as this article is making it seem like, cut all funding? I don't know that's the way to go. So far, HHS has made the deepest budget cuts government-wide under the Trump administration's efforts to radically slash federal funding, according to a tally listed on the Department of Government Efficiency's website. Okay. So HHS also canceled $877 million in grants to the Texas Department of Health and $482 million to Florida's Department of Health, among other cuts this week, according to Doge website. Alrighty. So this cut funding isn't being allocated to another area or to try to do something else with it health-wise to benefit people. It's just being cut to kind of trim the budget, to kind of scale things down. I don't really follow politics too closely, and I pay attention as much as I can, but it's a lot. It's a lot. Our healthcare system in this country is, when you compare it to other countries, you know, who have kind of have their own, I mean, there's pluses and minuses to everything, but it just, making health profit isn't the way to go. For profit, no, not the way to go. And all this funding being cut, I hope that this is kind of one of those things where you trim it and then you look to see what you can bring back or how you can make it better. I'm a half full type of person. I try to look on the brighter side of things, and some days it's harder than others. So I don't know. I don't know. What do you guys think? How you guys feel about this news? I mean, honestly, what shocks me more is the funding that's being cut. It includes funding for other diseases and support for HIV prevention. Because again, HIV is still a problem. You don't want to. All right. I'm at a loss for words, guys. Tell me what you think. I have got nothing for you. I just don't know if cutting that much was the way to go. We'll see how it works out in the long run.